what we do when ACL ligaments get injured. Whenever ACL ligament is not there, then we have to take a graft from the patient's leg, usually the ipsilateral leg or the same leg. We take a graft from the hamstring tendon graft, like semitendinosus and gracilis muscle. We prepare a graft and we replace the ligament or we reconstruct the ligament using that graft. Whole of the procedure is done with keyhole procedure, like arthroscopic procedure we call it. We make 5 mm incision here. Through the keyhole we insert a arthroscope and reconstruct the ligament using that hamstring tendon graft, and we fix it in the femoral side and the tibial side with the help of using interference screws and suspension loop. It is usually done as a daycare procedure, but sometimes we have to keep the patient for 24 hours. The surgery duration is usually 45 minutes, in which we do the diagnostic arthroscopy and inspect the joint using the arthroscope and see what other damage is there in the knee joint. Accordingly, we treat the damage and reconstruct the ACL ligament.